A new health alert has been issued as a fast spreading variant of COVID-19 begins to make global headlines. Health officials are sounding the alarm as the variant shows signs of increased transmissibility, raising concerns that it could outpace previous strains. And the worst part, vaccination rates are falling at the same time. This is not just a scientific update, it's a public safety emergency.
There's a health alert tonight for a new fast-spreading variant of COVID-19.
Gertie Sperling joins us in the studio. Gertie, it's prompted fears about falling vaccination rates.
It has, Will. Just 2 days out from the change in season, COVID's one of several winter viruses spreading rapidly through the community as vaccination rates plunge. Weekly COVID infections have doubled in a month. Flu cases are on the rise too, with 470 reported infections compared to just 180 several weeks ago. Authorities are also monitoring RSV, but it's the new fast-spreading variant of COVID-19 that's causing concern. It currently accounts for almost 10% of cases here, but it's quickly becoming the dominant strain interstate.
This new subvariant does look to be more infectious. It binds to the receptor the virus uses to get in more readily and is really effective at evading protection, particularly from past infections.
It's prompted a renewed push for booster jabs nationwide, and locally it's the under 5 age group that's still yet to take advantage of free flu jabs. The advice is to protect yourself now before it's too late.
Experts warn that if this trend continues, the combination of a more aggressive variant and low immunity could lead to another wave of outbreaks, hospitalizations, and disruptions. Welcome back to the channel. In today's urgent update, we're diving deep into the latest public health warning that's dominating headlines across the world. A newly identified COVID-19 variant is spreading faster than previous strains and showing troubling signs of immune escape, meaning it might be able to partially evade the protections offered by earlier vaccines and natural immunity. Scientists are closely tracking the variant, now officially listed under a watch classification by the World Health Organization. Early data indicates that this version of the virus replicates more quickly and causes a wider range of symptoms, some of which mimic seasonal flu or respiratory infections, making it harder to identify and contain in early stages. What's even more concerning, public fatigue with the pandemic is making the situation worse. With vaccination rates steadily dropping in many regions and booster uptake at an all-time low, health officials say we're creating the perfect storm for another major surge. Dr. Lisa Moreno, an emergency medicine physician, described the situation as a ticking time bomb, adding that complacency is just as dangerous as the virus itself. She emphasized that the public has grown numb to the term variant, but this one may not be like the others, particularly because it's spreading rapidly through high-density population centers and has already been detected in international travel hubs. Hospitals are beginning to report a gradual increase in admissions linked to respiratory complications, particularly among the elderly and immunocompromised. While it's not yet at crisis levels, the curve is climbing, and fast. Meanwhile, online misinformation continues to cloud the public's judgment. Vaccine hesitancy, distrust in institutions, and fatigue from ongoing guidelines are all contributing to a slower response to what could become a rapidly evolving crisis. Health officials are urging the public to stay informed, revisit their vaccination status, and consider masking in high-risk indoor environments, particularly as the variant makes its way into schools, offices, and healthcare facilities. While there is currently no evidence that the new variant causes more severe disease in the majority of healthy individuals, its speed and potential to infect previously immune people have scientists concerned. Labs around the world are racing to test the effectiveness of existing vaccines and antivirals against this strain, but those results may take weeks, and by then, containment could be significantly more difficult. Outlook? Cautious but concerned. Authorities say now is the time to act, not panic, but prepare. This includes ramping up testing, reevaluating booster campaigns, and pushing out accurate public health information to combat disinformation. What comes next will depend heavily on how the public responds in the next few weeks. Will we rise to meet this challenge with unity and action? Or will we sleepwalk into another preventable surge? Only time and responsibility will tell.